Alarming a rise in Americans with long COVID symptoms. The CDC reports a troubling rise in Americans experiencing long COVID symptoms, with nearly 18 million affected. David Petrino of Mount Sinai highlights the alarming speed of this increase. A survey shows a 1.5 percentage point jump in long COVID cases following a major infection surge this winter. Many of those with long COVID report significant limitations in daily activities, with about 3.8 million Americans severely affected. Job absenteeism due to long COVID has escalated in the US and UK. Current rates of long COVID haven't been this high since November 2022, peaking last summer. The CDC's Dave Daigle emphasizes the complexity of tracking long COVID due to various influencing factors. The Household Pulse survey indicates that symptoms persisting 3 months or longer may continue to rise. Long COVID's definition could mean actual rates are even higher than reported. Geographical differences are noted, with the highest rates in North Dakota and the lowest in Hawaii. The survey also found that 17.6% of American adults have experienced long COVID at some point. Children, too, suffer from long COVID, presenting symptoms like fatigue and more serious conditions like myocarditis. Experts like Laura Germanis from Harvard Medical School stress the unpredictable nature of long COVID's impact. Despite CDC's updated isolation recommendations suggesting a decrease in long COVID prevalence, experts criticize this outlook as scientifically irresponsible. Public health advice is under scrutiny for potentially increasing the spread of COVID and long COVID cases. Vaccines reduce long COVID risk, but avoiding COVID, especially repeated infections, is key to prevention. Reinfections reportedly intensify long COVID symptoms for many. Lack of a cure and slow research funding further complicate the battle against long COVID. Petrino predicts fluctuating long COVID rates with possible increasing baselines, stressing the need for better government protection and guidance. The uncertainty around the upper limit of long COVID cases calls for transparent risk communication to the public.